Hi everyone, let's start with the MCQ. Persistence of the ST elevation 24 hours after treatment for MI with the PCI is due to either it can be due to the rethrombosis or it can be due to the left ventricular aneurysm. For that, we can go with the CPKMB levels, in which we can see the rising trend in case of the rethrombosis, or we can go with the echo, in which we can see the motion wall abnormalities. So the answer of this question is option number A. Most common arrhythmia seen after MI, after pre-reperfusion strategy in MI, it's AIVR, which tells about reperfusion injury, and it's a good sign. Correct sequence of ECG changes in the acute MI. The firstly, there should be ST elevation, then there should be T wave inversion, and then the pathological Q wave changes which occurs. So the answer to this question is option number B. Always remember that in the ST elevated MI, we have something called the hyperacute T waves. This hyperacute T waves has to be differentiated from the tall tented T waves, which are seen in hyperkalemia, which are seen in case of the hyperkalemia, right? False positive troponin I can be seen in all except we can see in blunt trauma, we can see in PE, we can see in the renal failure, but it's not seen in case of the chronic liver failure. And hypertensive is brought with the BP of 220 by 130 millimeters mercury to the casualty. CT scan shows an infarct. What should be the primary BP of the patient to start thrombolysis? It should be less than 185, or we can take it as less than 180 by 110. CAD related to the decreased levels. CAD is related to the decreased levels of which HDL. We all know that HDL is associated with the reverse cholesterol transport with the help of a very important enzyme, LCAT enzyme. For this, the both 2 and 3 are involved, but most common is HDL2. Pulses alterance is seen in anterior wall MI, bronchial asthma, critical aortic stenosis, constrictive pericarditis. So it's anterior wall MI. Which of the following is associated with the atherosclerosis? So there is an etymological study which has shown the association between the chlamydia pneumoniae and atherosclerosis. Usual duration of the chest pain in chronic stable angina is around 5 minutes, or we can take as 5 to 10 minutes we can take. Then we have to understand that in case of the unstable angina, it's characterized by decrescendo pattern of symptoms, no, crescendo pain with the ECG finding, ST elevation, normal cardiac biomarker. So the option is crescendo pattern with ECG. There can be ST elevation also,